The world's largest drug maker, Pfizer, agreed today to pay the biggest fine in history to settle fraud charges involving marketing drugs for uses that weren't approved by the FDA. The company will pay a record $2.3 billion in civil and criminal penalties after admitting that the painkiller Bextra and 12 other drugs were promoted for what's known as off-label use, which the FDA says put public health at risk in the process.
Pfizer was alleged to have deceptively marketed drugs for purposes which were not approved of by the FDA. Those actions put patients at risk, caused exposure to health risks, heart attacks, and death. In addition, they settled allegations of paying kickbacks to doctors. One of their subsidiaries pled guilty to felony charges in that relation. And overall, what we found was multiple year schemes to advance the marketing of drugs.
Pfizer began paying doctors to attend meetings where it would pitch Bextra for things it was never approved for. Bextra has been linked to heart attacks and strokes and has been pulled off the market.
The FDA had noted that Bextra caused an excess of serious cardiovascular thromboembolic events during one clinical trial. Despite the FDA's decision, Pfizer's marketing machine positioned Bextra for the relief of all manner of acute pain as a complement to Pfizer's drug Celebrex, which it had positioned for use for chronic pain. Pfizer's marketing machine pushed this combination from 2002 through 2005. The marketing machine also pushed Bextra for other off-label uses. Among other things, Pfizer did the following. Pfizer invited doctors to consultant meetings, many in resort locations. Attendees' expenses were paid. They received a fee just for being there. Their job was to help Pfizer figure out how best to promote Bextra for the off-label indications. Pfizer's sales force claimed that Bextra was superior to Vioxx, when in fact Pfizer had never conducted any head-to-head studies between the two drugs for approved uses, and thus had no clinical evidence that Bextra was superior. Claims of superiority, when not supported by the label, are off-label claims and thus violate the Food, Drug, and Cosmetic Act. Pfizer utilized continuing medical education events to promote off-label prescriptions. Pfizer utilized a publication strategy to initiate, fund, sponsor, and sometimes draft articles touting Bextra for unapproved uses. This is the fourth Pfizer settlement with the Justice Department this decade. First, in 2002, Pfizer paid $49 million to resolve allegations that it had failed to report to CMS best prices for its drug Lipitor. Second, in May 2004, Pfizer paid $430 million, including a $240 million criminal fine for the off-label promotion of the drug Neurontin. Third, in April 2007, Pfizer and its pharmacy and Upjohn division, the same division involved here, pled guilty and entered into a deferred prosecution agreement for payment of kickbacks and for off-label promotion of the drug Genotropin. That time, Pfizer paid $34.7 million.
The Obama administration says this is a signal to the drug industry and those who defraud Medicare and Medicaid. Critics say Pfizer's getting off easy.
Even for Pfizer, this is a drop in the bucket for all their profits. The penalty should be larger.
Consumer advocates call this a victory and a wake-up call.
About 1 out of every 5 prescriptions are written off-label, so you need to ask your doctor, why is this the first drug you're prescribing, and is there something else that might be better?
One of the cables accuses the world's biggest drug company of trying to get out of paying damages for a clinical trial in Nigeria. Children died after they took an experimental drug, possibly without their parents' permission. The document reports Pfizer tried to dig up dirt on a Nigerian official to get him to stop legal action over that study. Quoting this cable, Pfizer had hired investigators to uncover corruption links to the federal attorney general, to expose him and put pressure on him to drop the federal cases. Last year, Pfizer agreed to a tentative settlement, $75 million.
It's a notorious 1996 drug experiment that Pfizer conducted on sick children in Nigeria when researchers selected 200 children at an epidemic hospital for an experimental trial. About 100 of the kids were given an untested oral version of the antibiotic Trovan. That Pfizer did not tell their parents their children were getting the experimental drug. 11 children died. Others suffered disabling injuries, including deafness, muteness, paralysis, brain damage, loss of sight, slurred speech. After an 11-year legal battle, Pfizer paid compensation to 4 families. About 10 years ago, we spoke to Musikilu Mojid, a Nigerian journalist who worked on this story for the Next newspaper in Lagos. He described what Pfizer did in Nigeria.
It all began with a confession of a drug company insider.
I was trained to deceive, to lie to doctors.
Whistleblower David Franklin said the company deceived doctors about its anti-seizure drug Neurontin and illegally promoted it for other uses, possibly risking lives. Well, last month, the Pfizer company pleaded guilty on behalf of its subsidiary Warner Lambert and agreed to a settlement of $430 million.
Every major media outlet in the United States shares at least one board member with at least one pharmaceutical company. Let me put that into perspective. These board members wake up, they go to a meeting at Merck or Pfizer, then they have their driver take them over to a meeting with NBC to decide what kind of programming that network is going to air. And for those board members who aren't pulling double duty with a media conglomerate in a big drug company, they still understand that they can't be mean to Big Pharma because Big Pharma pays their bills. Drug companies spend about $5 billion a year on advertising with these media outlets. So when you have a case against Pfizer or Merck or Eli Lilly or any of the other major pharmaceutical companies, do you think those board members are going to let you get on the air and tell a story that's bad about what they do? Or are you naive enough to believe that they really don't interfere with the day-to-day operation? Whether it's Strike or hip implants, or C8 killing somebody, or Vioxx killing somebody, or Roundup causing cancer, Xarelto or Essure talcum powder, the corporate media doesn't care about these stories because they either share board members with these companies or because they want those companies to keep throwing huge advertising dollars their way. These gigantic media corporations aren't going to do a thing to threaten their relationship with their biggest advertisers. And one way or another, they're always going to express the ideological views of their owners, their corporate owners. According to Open Secrets, Big Pharma spent more than $58 million on politicians in 2016, the most amount they've ever spent on direct contributions in the last quarter century. Why? Because they, big drug companies, want politicians to do what they order them to do. And when it comes to lobbying, few industries spend more than Big Pharma. Last year, the industry spent a staggering $244 million to influence our elected leaders in Washington, D.C. And it looks like things are about to get much, much worse.
For the first time ever, Pfizer, the world's largest drug company, is telling us how much it pays doctors. Critics call the payments a big conflict of interest, and they say they could even put you in jeopardy. Darren Gersh reports.
Pfizer's long list of payments are an example of what many analysts have long argued. The drug industry has extensive financial ties with the doctors who prescribe its products. While doctors do need to work on drug research and development, the Pew Prescription Project's Alan Cockle says other payments raise serious ethical concerns.
There are a lot of doctors who are out there giving speeches which are essentially promotional. They're functioning as a marketing arm of the companies. And we just think that that has the potential to influence prescribing and isn't consistent with evidence-based medicine that's guided by good science.
Of the $35 million Pfizer paid doctors in the last 6 months of last year, $15 million went to research. $17 million to doctor speaking fees and consulting.
You look at this thing, and I mean, if Pfizer is too big to fail, and even the biggest fine in history is just a few months' profit, then what's going to stop it from illegally promoting other drugs?
Critics say Anderson nothing.